Andrew Kornstein, and I'm a plastic cosmetic surgeon. And I practice in New York City on Fifth Avenue and in Wilton, Connecticut.
What are the main procedures that you do?
My practice is roughly half body and half face. And a lot of people these days really want experts in certain areas. But I think that it might be a little bit short-sighted, because when you concentrate on one area, your level of achieving an intimacy with Mother Nature is really hindered. And I don't do anything that I'm really comfortable with or feel that I do as well as anybody else. But I tend to go all over the body because I'm very innovative. So I don't do an operation per se. I treat every area as an aesthetic unit. And so the goal is I want to feel and look better around my midsection, or I want to feel and look better around my breast or my face. So I don't look at it as one operation. I look at it as, what do I need to do to make that area look beautiful?
So practice regenerative medicine. Can you explain to me what that is?
Regenerative medicine basically to me means that you're doing something that is not a static operation. Most operations in cosmetic surgery are two-dimensional operations. They're cutting and pulling operations. And they're static in the sense that when you leave the operating room, the patient continues to age. But if you use regenerative principles, you add, and regenerative principles come from an understanding of the anatomy, an understanding of how we're developed, and an understanding of how we age. And I try to use Mother Nature to stop that from occurring, from progressive aging.
So how do we harness Mother Nature?
In stem cells. They're the most obvious and plentiful and fortunately the most powerful stem cells. And they're fat-derived. They're available almost anywhere on the body. And in other words, a lot of people do believe or did believe that one area of the body had better stem cells than another. But my belief after more than 20 years is fat-derived stem cells are all of equal potency.
Do you use any other stem cells besides fat-derived?
No, that's the other major stem cell would be bone marrow. Mm-hmm. More painful to obtain, mm-hmm. much harder in terms of the volume you need. Mm-hmm. And then people are using a lot of PRP, which I find, where I believe is really more of a marketing mm-hmm. idea. I think PRP is a great anti-inflammatory, but it does not function as a stem cell per se, in my opinion.
Mm-hmm. So you derive the stem cells from the patient's own fat.
Correct.
And is this something that you process in your practice?
Correct. Now, according to the FDA, if you either adulterate the stem cell or you store it for use at another time, it's considered a drug. If you take it out of the body and you isolate the cells and use it at the same time, it's basically your desire to use what's in your body to help yourself. And so that's essentially what we do. We harvest the fat at a very low pressure, so I do everything by hand. There's no machine involved, and that's what takes the operations. The operations can be quite long because I don't want to traumatize the fat cells. I want to keep as many viable fat cells as is possible. So it's all hand-held lipo. Then they're concentrated in syringes, and then we use a centrifuge to get rid of anything that is not living. So when it layers out, we get rid of oil, which is essentially fat cells when they die turn into oil. We get rid of that. There's serum from the addition of tumescent fluid. That's all removed. And then we just concentrate the fat cells for injection. And my team has been together for 18 years. That means my anesthesiologist, my surgical assistant. So the whole process moves very efficiently and allows me to focus on the actual project at hand, which is really the artistry and the aesthetics and the survival of the fat cell.
Now, you said you've been doing this for 20 years. I didn't think this was available 20 years ago.
It was, but it was a matter of popular opinion that it really was a waste. like life, you have to be lucky. I happen to be in the right place at the right time a couple of times in surgery. One of the times was when Sid Coleman, who is the father of modern fat grafting, was attending in my program. And when I was a resident, he was just starting to tinker with fat grafting. So he actually developed his whole process when I was a resident, and I observed that. The other fortunate thing is his inclinations in terms of how to harvest the fat, how long to centrifuge it. All those things haven't changed in over 20 years. He picked all the right steps, and evidence is borne out that they are the right steps. And when it comes to facial fat grafting, I tell all my patients roughly 95% take, and that's true in virtually more than 95% of patients because of experience in terms of the injection process and the luck of how Dr. Coleman and myself, who picked up after him, decided to isolate the fat cells.
Now, in the 5% that doesn't work, why does that happen and what happens?
Okay, so in the 5% that doesn't work, I think that in order for the fat to survive, you have to put little parcels in. So the analogy I use, or the metaphor I use, is you don't want to put it in a lake because the blood supply comes in from the shoreline. So the center of the lake gets no blood supply. You want to put in little streams because, again, the shoreline is close. And so what happens is you have to digitally be very accurate in terms of how much fat you put in one area. So if you are putting in a stream that's a little bit too wide, there's about 3 to 5 days where the fat cell lives by just diffusion or getting nutrients around itself. And if it's too far away to get nutrients, by the time the blood vessels start growing in, the fat cell is gone. And I think that 5% lost in a situation like that, where I do rejuvenation from hairline to chin, I think I don't want to say acceptable, but it doesn't change the cosmetic result, and it doesn't mandate that the patient needs to come back for another surgery.
You had mentioned harnessing Mother Nature. So in all of the procedures that you do you incorporate stem cell therapy?
I wouldn't say all, but in many. So anti-aging of the face. I think that there is no question that fat-derived stem cells changes the aging of the face. There's no doubt about it. And in my opinion, we know from CAT scan studies exactly where the bones of the face age. And that's not a matter of conjecture. We also know from other studies that if you put fat adjacent to the dermis or the underside of the skin, you're going to revascularize the skin and return collagen and elasticity to the skin. So my opinion, again, not proven yet, but my opinion is that what we're doing is we're restoring circulation to the bone. So the areas where we typically lose bone are being lost because of a depletion in circulation. By adding fat, we're restoring circulation, and therefore the bone does not atrophy. And I've had patients for over 20 years, more than 20 years, that look the same as they did when they came in.
That's kind of remarkable.
It is. I think that it's a tribute to the patient. Again, you didn't realize that stem cells were around for 20 years. So if you think about those patients, they put their face in my hands based on trust, and they're really, they're feeling really good about things right now because they could see the divergence of their friends and how they're aging, and then how the patient about the fat grafting have aged. So it's a very powerful technique. And in my philosophy, again, this is something you're not going to read, but I have a philosophy where there's generally 3 layers to the face that we need to treat. There's the bone layer, which needs to, if you keep the bone at its normal volume, you have beautiful, youthful shape and anti-gravity support. There's the facelift layer, and then the third layer is the skin. And if you stabilize the bone with fat-derived stem cells, it's going to give shape to the other two layers.
Right.
But not everybody comes in early enough. So we have ways to treat the other two layers if, let's say, you come in and there is some aging in the soft tissue layers. So we can get people back on track where they're looking youthful, natural, but their aging is slowed.
Are you unique in treating sort of the scaffolding that the soft tissue drapes over? Are you unique in using stem cells for that, or do other people do that with bone?
I think other people are doing it. Some people tend to be more formulaic, and they use fat like in a plane where they would use a filler under the skin. And I think that is really not where the fat does its best work. So I generally put most of the fat on the bone because those are the areas that are either have lost volume or at risk of losing volume. And then I work from deep to superficial. So there's certain areas that do require fat under the skin, and the most common areas are around the mouth for the little wrinkles around the mouth, the marionette lines, the corners of the mouth, and the upper and lower eyelids. There's nothing that gets rid of dark circles under an eye, and I know it's a powerful statement, but I've never seen a laser or anything work with dark circles. It takes the circulation that fat brings in to get rid of dark circles, and that works universally.
So you take tiny little amounts and do like little kind of channeling around the eyes?
I make a little poke hole in the skin right at the corner of the nose,
right,
and that allows me access for a blunt little needle, blunt tip needle, and I essentially am putting little picket fences up against the bone that is going under the eyelid muscle, which is probably the thing that is giving us the dark circles. Because as you lose support in the cheek area, the muscle's got to get stronger to push the lower eyelid up against gravity, and it's the color of sushi tuna, just a deep purple. So it transilluminates dark through the skin, and once the fat's there, the muscle can relax and thin out, and it doesn't look as dark.
Oh, that's interesting. I've never heard that explanation before.
I think, again, a lot of what I do is not based on what I've read. It's based on personal experience and close observation.
What about body rejuvenation? How do you use stem cells for that?
Most commonly the breast. More and more commonly, women don't want implants, or if they have implants, they don't want to feel them. So you could either use fat alone for an augmentation or put in a smaller implant and help camouflage the implant with fat. And that's really very popular because also you could change the shape of the breast with fat. You could improve the width of the cleavage and also the transition between the breast and the décolleté. Again, more of an aesthetic unit than just one organ. So if you think about what's exposed most in a woman's chest when they're wearing either a gown or an open shirt, it's a décolleté. So if you have a little breast showing that looks very youthful because it's enlarged with an implant, but the décolleté looks older by comparison, are you really doing yourself any good by showing that? No. Right. So by using fat grafts all throughout the décolleté, there is a youthifying of the whole area, and the breast looks better, and so does the décolleté.
That's really interesting. I've seen that, firm implant, crepey skin combo before. I think
that a lot of people do things and they don't think. And common sense is one of the things that's really lost in medicine and maybe the world in general. But I think you have to think about what you're doing and what you're creating. And I think the other interesting thing is that some patients are discriminating, and those are my favorite patients, the ones who push me to be the best I can, whereas other patients want what their friends had. And like if their friend had an implant, they just want an implant, and they think they're done. But that's not the best use of an aesthetic surgeon, and it's not the best use of all the tools we have in our hands, like fat-derived stem cells. Fat-derived stem cells are also great if you've had radiation damage from, let's say, breast cancer treatment. It's great for scarring. It's great for areas of trauma where either you've lost soft tissue from anything from bad surgery to accidents, and it works wonderfully. I had a patient from California, young girl who was in a car accident, and her shoulder area lost all the muscle, and she had a skin graft over it. So there was a contour problem, and the skin graft didn't look very young or youthful. So in one treatment, it just took one treatment of fat grafts under the skin graft now looks like normal skin, and her shoulder looks like a round, normal shoulder. Wow. So it was a pretty dramatic transition.
Wow. So what are the complications that you've seen?
They're really few and far between, and I'm so careful when I say that because it sounds not realistic. But I think fat grafting is a double-edged sword. If you are experienced with it, if you are respectful of the technology, and one example is a lot of doctors talked about 2-hour breast augmentation with fat. That was a big, I don't know, maybe 4 or 5 years ago in our society. Our society, meaning the Plastic Surgery Society, getting it done in 2 hours. And so that requires using large syringes and putting in big volumes at a time. And that's, like I said, the lake phenomenon. And so most of the fat died. And in the breast, you have to worry about the fat dying. And then when it dies, it could develop calcifications that on a mammogram could make it a little bit difficult for radiologists to discern what's healthy tissue with calcifications versus a cancerous tissue. Whereas when I do it, it takes a longer amount of time, but I do it with 1 cc syringes. And I've done a review of all my, or not all, but like the last 30 fat grafting cases. And I don't think I've had one call from a radiologist or seen one report where there's been any microcalcification. So it's a matter of technique that really limits the complications. And I would say that the other things that can occur are mostly aesthetic, underfilling or overfilling. Lumps and bumps, I think, are really, again, something that have to do with technique and the fact that I do more filling deep on the bone and less towards the skin. I like to rely on other modalities for tightening the skin. And when you put fat in an environment where the skin is tighter through non-invasive skin tightening, you don't have to worry about laxity and adding fat close to the back of the skin. So you get a much better result keeping it deep where it belongs, and you limit complications that way.
Wow. So where do you see this going?
I mean, I think Walt Disney said, as far as you can imagine. So I think that fat grafts are here to stay. They're not a fad. I think people treated them as a fad for a while. People really, doctors especially, I've been in practice, as I said, for over 20 years, and patients would get second opinions, and it was routine that a patient would either not come back, or if they did come back or call, we would hear that the doctor said that it's not going to last, it's not going to work. And again, if you go on the internet now, you're also going to see you need 3 injection cycles, all that stuff. So it
do
really...
you?
No. The vast majority of what I do is 1 injection cycle. The face, the breast, scars. The one routine exception to that is if you want a larger augmentation with fat. There's only so much fat the body could take at one time. So, I'll warn the patient ahead of time that they're going to need two grafting cycles. But for the most part, it's 1 and done. And but again, very technique dependent, both in terms of the 3-dimensional sculpting, because you really are doing a 3-dimensional sculpting, and in terms of the survival. So in terms of where fat's going to go, I think that there are a lot of doctors who don't get good survival. And I think that for those people, the addition of some of the refined stem cell elements mixed with fat grafting will enhance their ability to get fat grafting to survive. Also, there may be more potency by concentrating the stem cell. So it depends what you're trying to treat. If you're treating radiation damage, and I use conventional stem cell or fat-derived stem cell theory, you get a significant reduction in the hardness in that area of the breast, let's say, from radiation. But it's not eradicated. So let's say we use a more concentrated stem cell mix. Maybe we'll eradicate it completely. But I think that it's going to be a function of two things. The concentration and the potency would be one thing. And then in terms of the cosmetic element, the only thing that I see at this point is the ability to grow more stem cells, because people could want fat everywhere in their body, but there's only a limited supply. And when you put on weight, which is I still hear doctors doing, people are going here and there to different doctors, but they're told to put on 25 pounds. It doesn't make sense, because all you're doing is enlarging the cell. You're not creating more cells. So it doesn't really make sense. But again, people are out there, making up rules that don't have physiological basis. So you need to create more stem cells. And so the question is, how do you do that? And that's something that probably will be considered more of a drug, FDA involvement. Then you're up against big pharma and all these other people that are really going to, I think, they're going to have a hard time competing with the safety profile of Mother Nature and what stem cells can do.
How long do these rejuvenation treatments last generally?
Okay, so it depends. All my anesthesiologists have had them. All their families have had them. My staff has all had them. And so if you ask them, they say forever. And what does that mean? That means that the fat doesn't go away, but after 15 or 20 years, you have enough bone atrophy, fat atrophy, soft tissue stretching of the skin that you'll need some additional procedure. But I would say that I tell them, when I first was in practice, I used to say 5 to 7 years. Now I said 10 to 15 years. But in fact, I've had patients that have come back after 20 that haven't changed. I operated on a woman today that had her fat done 8 years ago. She's 48 years old, and she looks better now than she did 8 years ago.
Are they experiencing other beneficial side effects from, you're putting stem cells back in your body?
I don't know. Besides the fact that their facial contour is more youthful. So when you see someone on the street that you've never met before, why do you know that they're in their 30s, 40s, or 50s? Because we're trained from a very young age to read facial shape and morphology. Right. So I really have a good understanding of that language, and I can return that. So their shape is better. So they look and are perceived as being younger and more attractive. And that positive reinforcement, I think, has psychological benefits. I think their skin feels better. And the rapidity with which they age has been dramatically slowed. So, that negative mantra in the morning of, I look like crap, in front of the mirror, until you get your makeup on and, then you forget about things and get your day going, that's all gone. But in terms of any systemic effects, I wouldn't be surprised if there were some systemic effects from these living fat cells. But at this point, it's just a matter of conjecture. So I think it would be more the psychological benefits, which are enormous.
Can you give me a list of all the different cosmetic procedures in which you use stem cells?
Okay, so starting from the top down, oftentimes they're a great adjunct for hair loss when they're put under their scalp. Number 2, general facial rejuvenation, meaning having a much more youthful and aesthetic look, as well as aging more slowly. Number 3, I wrote a paper on the treatment of upper lid ptosis, which is, ptosis is when your upper lid is low into your pupil and you have that kind of tired bedroom eyes. Generally, people will cut the upper lid like a conventional upper lid blepharoplasty and have to shorten the muscle. The problem is the brain sees both eyelids in the same way. It doesn't differentiate between left and right. So oftentimes I got to go back and forth to adjust them. What I do is I use fat as a fulcrum, and they both elevate according to where the brain wants it to be. So it's a non-cutting way of treating ptosis. And then it's also great for wrinkles. So wrinkles anywhere, let's say around the mouth, in the décolleté. It's also great for scars anywhere. And most scar revisions I do don't involve cutting things out, but actually injecting fat. It's also great for dyschromia or color issues. If, let's say, you're olive skin and you're prone to getting dark spots in your skin, it's the best thing to get rid of any kind of melasma or any kind of dyschromia. It's the only thing I've ever seen that reliably works on dark circles under the eyes. I've used fat grafting as part of a rhinoplasty because oftentimes we lose bone at the top of the nose, and as the top of the nose shrinks, it makes the bottom of the nose appear much larger. I use it instead of a chin implant because I could shape asymmetric chins with fat, whereas chin implants and cheek implants, for that matter, come in one size only. Going down the body, décolleté, breast, back of the hand's very popular. If you have a really good-looking, youthful face, but the back of your hand looks old, it's kind of a giveaway. So camouflages tendons and veins. I use it a lot, let's say, when someone had a tummy tuck, but their area on their belly button looks operated, very flat. It doesn't look natural and curvy. So I'll shape that area of the body. The buttock is a big area now. Everybody's talking about it. I'm not into the shaping large butts or making large butts, but more creating beautiful shapes with fat. I've used it for ulcers in people who either have had little veins injected where they miss the vein and they inject the sclerotherapy into the skin and you get a little ulcer that won't heal, and the fat gets rid of that. Trying to think of some of the other. I just did a woman who has a very long leg from the knee to the ankle, and it was overly thin. So she never, ever wore a skirt or shorts. And you could put an implant in the calf area, top of that leg, but you can't get down near their ankle. So I use fat grafting to shape and enlarge her lower leg around the ankle to take, so she didn't look like what's the bird that stands on one leg?
Stork.
Or a stork or whatever, yeah. And so she, now she's wearing skirts and, and shorts again. And mentioning calf implants, oftentimes I'll use fat to enlarge calves. Now, sometimes bodybuilders want that, but generally bodybuilders don't have a lot of fat, so they're hard candidates to do that. But there's a lot of women who their calves they really don't do their legs justice. So I could elongate the calf muscle. I can enlarge or shape the calf muscle. It's also great if you've had bad surgery done and bad lipo and you're not smooth and, again, you just don't feel good about your body. You took that step to feel good about yourself, invested your time and your energy and your money in doing something positive for yourself, and it backfired. So fat is the only way to get you back where you belong. And it's interesting because fat works incredibly well for that. It's almost like Mother Nature knows what she wants, knows where she wants it, and if you're going to go and venture to do it, she will help you enormously. So those areas also do really well with one procedure. So it's a kind of thing where, wherever there's subcutaneous fat that might be missing or altered, it's great when you have loss of bone. And one of the more common areas is if you do a lot of breast augmentation, which I do, the breast sits on a rib cage, and the rib cage is the platform. And most women have an asymmetry in the projection of their rib cages. So even with asymmetric implants, you can't get them to look the same. And so what we do is we use sizers, we sit them up, get the implants as best we can, and then we use fat grafting over the breast, because you could put fat wherever you need it, so you can get them virtually identical. And it takes a breast operation that looks good and makes it something that everybody recognizes as just something you want to look at. It's incredible, because the human eye knows beauty. And that's really the key thing. I think a lot of plastic surgeons are in this business and they don't know what the end point is. So if you're in any business, you have to know what the end point of if you're a stockbroker, you have to know when to get in and when to get out. If you're a interior designer, you have to know when too much furniture and too much stuff on the walls is enough.
Right.
I think a lot of people in cosmetic surgery don't know what beauty is. They don't recognize it. And so you're doing things from a rote perspective and not an aesthetic perspective. And so I think that fat allows you to three-dimensionally sculpt almost any part of the body to deliver a higher aesthetic. But the beautiful thing about that, it's not static. It is an active, ongoing, rejuvenative process. And there are so many nutrients and chemicals that are going through the blood vessels of our bodies at any one moment,
right,
that we're not even aware of. And so we're basically putting in the highway for Mother Nature to deliver what she needs to those areas.
Well, that's very exciting.
It really is. And it's changed my career because I grew up with fat grafting. And so I never had to settle for what was possible with conventional surgeries. There was always that addition of doing a facelift with fat grafting, breast implant with fat grafting. The fat grafting really allowed you to three-dimensionally sculpt almost any area of the body.
Wow, what an incredible toolbox.
It really is. And again, I was lucky to be at the right place at the right time at the beginning. And I never had to unlearn anything, if you know what I mean.
Yep.
I started with that tool and helped develop it, and that was very exciting.
Well, thank you so much for coming here and speaking with us today. I really appreciate it.
That's great. My pleasure.